Welcome to our video on developmental milestones and growth. Let's get started. Here is our overview slide. Let's begin by discussing developmental milestones. An infant at the age of 2 months should be able to raise his or her head and chest in the prone position. Additionally, the fine motor development is significant for the ability to follow objects with the eyes past the midline. Social and cognitive development at this stage is characterized by parent recognition and a social smile. Finally, a 2-month-old should be able to coo. At 4 months of age, an infant should be able to maintain their head straight and hold him or herself up using the wrists in the prone position. Additionally, the infant should be able to hold a rattle, localize sound, and laugh. At 6 months of age, an infant should be able to roll over from the back to the front and sit up unsupported. In terms of fine motor skills, they should be able to transfer objects from one hand to another, and they should have a raking grasp. This refers to an infant that can hold an object with all of the fingers except the thumb. With regards to their social and cognitive development, they should begin to have stranger anxiety at this point, and they'll develop object permanence. This means that even if the object disappears from the infant's sight, he or she will start looking for it. Finally, at this stage of development, infants should babble. Here's an image which helps demonstrate the raking grasp. Note how this individual holds the object with all the fingers except the thumb. At 9 months, an infant should be able to crawl and stand when supported. They should also develop a pincer grasp. And this is when an object can be held between the index finger and the thumb. As far as social and cognitive development, a 9-month-old will begin to have separation anxiety. And with regards to their language skills, they should be saying mama and dada at this point. Here's an image of a pincer grasp, and note how this person is holding an object with the index finger and the thumb. At 12 months old, the infant walks and points to objects. A 2-finger pincer grasp develops either at 9 months or 12 months, and he or she also follows a 1-step command and knows 1 to 5 words. All right, let's move on to the development milestones of toddlerhood and preschool years. At 1.5 years old, the child should start running and can stack approximately 4 blocks on top of each other. At this age, he or she develops pretend play. In other words, the toddler starts to mimic playing movements. Additionally, he or she should know about 10 to 50 words. At 2 years of age, a child should be able to jump, kick balls, and walk on stairs with both feet on each step. They should be able to stack approximately 6 blocks. They should develop parallel play, which refers to the ability of 2 toddlers to sit next to each other but play independently. Rapprochement, on the other hand, is when the child moves away and then returns to his or her parent. Finally, a 2-year-old should be able to follow 2-step commands, and they should know at least 50 words and speak in 2-word sentences. At 3 years of age, the child should be able to walk on stairs with alternating feet and ride a tricycle. With regard to their fine motor skills, they should be able to stack approximately 9 blocks and copy a circle. At this stage, the child begins to develop gender identity, so they should know the difference between male and female. The speech of a 3-year-old is 75% intelligible, and they should be speaking in 3-word sentences. At 4 years of age, a child should be able to hop on 1 foot and copy a square. They should also engage in cooperative play. In other words, children can now play with each other. Having imaginary friends is also a normal part of development at this stage. And at this point, the child should tell stories and should be able to identify colors. Finally, a 5-year-old child should be able to walk backwards, copy a triangle, and write some letters. At this stage, he or she dresses up and understands directions of left or right, and they should also be speaking in 5-word sentences fluently. Here is a table that summarizes the developmental milestones from 2 months to 12 months. Feel free to pause the video and review the information. And here's a table summarizing the developmental milestones from 1.5 years of age to 5 years of age. All right, let's review with a question. A 4-year-old boy is brought to the physician by his mother, reporting a strange behavior for the last 6 months. The mother has noticed that the boy talks to himself in his bedroom when there is nobody there. He is an active, playful child. He attends kindergarten and has several friends there. When the physician asks him about his friends, he says, "My best friend is Mike. He is always with me, but nobody seems to notice him but me." The mother asks if her son needs a medication. What is the best next step in the management of this patient? All right, this patient is an active, playful child with several friends in kindergarten. This indicates that he is functioning normally in society. His best friend is Mike, but according to the patient, nobody seems to notice Mike. So Mike is most likely his imaginary friend to whom he talks when he is alone in the bedroom. Having an imaginary friend is a part of normal development for a 4-year-old child, and it helps the child acquire social skills by practicing various social situations. Therefore, the best next step in the management of this patient is just reassurance of the mother about the normal nature of the son's behavior. All right, now let's discuss growth. A child's growth is tracked with growth charts depicting the child's weight, height or length, and head circumference compared to age. The weight, height, and head circumference are expressed as percentiles. Here is an image showing us a growth chart. We can see length and weight on the vertical axis and age on the horizontal axis. All right, let's talk about normal weight for age velocity. Neonates normally lose 7% or less of their normal birth weight and regain it within the first 2 weeks of life. Loss of up to 7% of weight is a normal finding, and parents should be reassured if there is a concern. The birth weight approximately doubles by 4 months, triples by 1 year, and quadruples by 2 years. Now let's discuss normal height or length for age velocity. From birth to 6 months of age, the height increases by approximately 2.5 centimeters per month, while from 6 to 12 months of age, the height increases by approximately 1.3 centimeters per month. Now let's focus on the normal head circumference for age velocity. Head circumference increases by approximately 5 centimeters within the first 3 months, 4 centimeters from 3 to 6 months, 2 centimeters from 6 to 9 months, and 1 centimeter from 9 to 12 months. The reason we're discussing the normal growth parameters in such detail is because we need to know when the child's growth is abnormal. For example, in order to diagnose a child with failure to thrive or macrosomia, we need to consider these parameters. All right, let's try a question. A 5-year-old girl is brought to the physician by her mother for a routine visit. She was born via spontaneous vaginal delivery. The birth weight was 3,600 grams and the length was 50 centimeters. The vital signs include a temperature of 36 degrees Celsius, a blood pressure of 75/50 millimeters of mercury, a heart rate of 120 beats per minute, and a respiratory rate of 50 breaths per minute. The mother says that her daughter looks a little skinnier than normal. The current weight of the baby is 3,420 grams. What is the best next step in the management of this patient? All right, this is a 5-day-old patient presenting with a slight weight loss. Her birth weight was 3,600 grams, while her current weight is 3,420 grams. She lost 180 grams, which is 5% of her birth weight. And recall that neonates can lose up to 7% of their birth weight within the first 5 days and then regain it within the first 2 weeks. Since this patient lost less than 7% of her birth weight, the best next step in the management is to reassure the mother and counsel her on continuing to breastfeed. All right, now let's talk about failure to thrive. Failure to thrive, abbreviated FTT, is when the length for age, weight for age, and BMI for age are less than the 5th percentile compared to normal values. FTT has non-organic and organic causes. Non-organic are the most common ones. Non-organic causes include poor socioeconomic status, child neglect, inadequate preparation of formula, or inadequate feeding. Organic causes include a cleft lip and palate, which can cause a poor latch and difficulty breastfeeding. Other organic causes are celiac disease, inflammatory bowel disease, and cystic fibrosis, because all of these can cause some degree of malabsorption. Additionally, hypertrophic pyloric stenosis and GERD can also cause failure to thrive. This is not a comprehensive list for organic causes, however, it gives us an idea about what kind of diseases can contribute to failure to thrive. The diagnosis is mostly clinical by investigating the feeding habits of the baby. The necessity of laboratory studies or imaging studies is based on suspected organic causes. The first-line treatment is nutritional rehabilitation and parental education about adequate feeding. For organic causes, the management is disease-specific. All right, now that we've covered the information, let's review with a final question. A 2-year-old boy is brought to the physician by her mother for a routine well-child exam. He was born at 39 weeks of gestation via spontaneous vaginal delivery. His age-appropriate vaccinations are up to date. The patient walks by holding onto the furniture. He stacks 3 blocks on top of each other. The physician observes that the patient moves away from his mother and returns to her. He comes to the table and picks up a toy after being told to do so by his mother. The vital signs in the physical exam are unremarkable. Which of the following is the most accurate interpretation of this patient's development? A. Delayed gross motor, intact fine motor, intact social development. B. Intact gross motor, delayed fine motor, intact social development. C. Delayed gross motor, delayed fine motor, intact social development. Or D. Intact gross motor, intact fine motor, delayed social development. All right, this patient walks by holding on to the furniture. Normally, a 2-year-old child should be able to jump, walk freely, and walk on the stairs with both feet on each step. Therefore, this patient's gross motor development is delayed. He also stacks only 3 blocks on top of each other, and a normal 2-year-old child should be able to stack approximately 6 blocks. This discrepancy between the normal and observed findings suggests a delayed fine motor development. Finally, the patient moves away from his mother and then returns to her. He also follows a 2-step command, and this indicates an intact social and cognitive development. Therefore, the correct answer is option C, delayed gross motor, delayed fine motor, intact social development. From this slide, we can see the normal developmental milestones for a 2-year-old child, which we discussed earlier in the lecture. A is incorrect because although this patient has a delayed gross motor development, his fine motor development is also delayed rather than intact. B is incorrect because this patient's gross motor development is delayed rather than intact. And finally, D is incorrect because both gross motor and fine motor development are delayed in this patient while social development is intact. So again, the correct answer is option C. And that concludes this section.